Hello guys, how are you doing? Hope you are all good. Today I'm going to discuss myofascial pain syndrome. What is myofascial pain syndrome? It is a chronic pain disorder that occurs in 85% of the people during any time of their life. It is often misdiagnosed or overlooked because of the symptoms related to the other diseases. Men and women in the myofascial pain syndrome are equally affected, though middle-aged inactive individuals are at higher risk. It is a muscular problem related to either prolonged muscle contraction, for example in case of the athletes, or lesser muscle contraction in case of the sedentary lifestyle individuals. Myo in this means muscles and fascial means fascia, which have the nerve endings and that cause pain. It can develop in any muscle but most common in the upper back, shoulder, and neck region. This condition is mainly related to one or more trigger points. Now, what are trigger points? These are the points in muscles that are painful to touch and have a twitch response. These are hyper-irritable spots and feel like bumps, nodules, or knots in muscles. There is pain on rest as well as pain when pressing on the specific point of muscles that is referred to the other areas of the body and does not follow dermatomes, myotomes, or nerve roots. Many trigger points present as tinnitus, temporomandibular joint pain, tension headaches, decreased range of motion, and backache. Now, what are the types of trigger points? Trigger points are of four kinds: active trigger points, inactive trigger points, secondary trigger points, and satellite trigger points. Active trigger points are those points that can occur at any point in the muscles as well as produce pain and tenderness constantly or during movement. They reduce the flexibility of the muscles. Inactive trigger points, they are called dormant or latent trigger points. They can also develop anywhere and feels like bumps that are only painful when they are compressed. Secondary trigger points, located in the muscle other than the one that holds active trigger points. They can be irritated at the same point as the active trigger point. Satellite trigger points, those that become inactive because they overlap with the region of another trigger point. Causes of myofascial pain syndrome: muscle overwork or injury, lack of exercise or prolonged sedentary lifestyle, working or living in the cold environment, vitamin deficiency such as folic acid deficiency, improper posture, aging, emotional stress or any type of chronic stress, sleep disturbances, pinched nerve. Symptoms: deep aching, throbbing, tight, stiff-like pain in that region. Trigger points in the muscle bellies are formed in myofascial pain syndrome. Weakness in the affected muscles. Reduced range of motion in the affected areas. Some people also have other symptoms like headache, poor sleep, stress, anxiety or depression, and fatigue. Diagnosis: only physical examination, findings, and applying pressure on trigger points resulting in pain can diagnose the condition. Compression of the specific point results in jumping of the patient due to the extreme tenderness, which is also called jumping sign. No neurological deficits observed. No visible signs, for example redness, swelling, and warmth on that area. No test, no imaging or lab test can confirm the diagnosis. Management: strengthen, stretch, and relax the affected muscles. Inhibition ischemic compression technique is used. Dry needling, wet needling, spray with a coolant, and stretch. Laser is extensively used for this purpose. Ultrasound therapy is widely used. Acupuncture, Analgesics, muscle relaxant, and NSAIDs are also given. Steroid therapy, antidepressant, and sedatives to improve the quality of sleep. Thank you. Have a good day. Click the like button and subscribe to this channel.